Hi, everybody. The question that is burning up the airwaves today is, will Medicare pay for a caregiver to take care of the elderly? My elderly parent, myself when I'm older, a family member. So in society, until you learn more, there is this expectation that Medicare takes care of all health-related and care expenses after a person turns 65. This question that caregivers are asking all the time is, will Medicare pay for a caregiver to take care of my parent, my spouse, me when I get older? The very simple answer is no, which is often shocking to caregivers. So in this video, I'm going to offer some information about some new programs that are coming out through Medicare that will support caregivers under certain circumstances. Now, these programs do not offer a substitute caregiver. They involve you as the caregiver. Now, for those of you who are like, well, yeah, Medicare does pay for caregivers. Well, that's under a certain circumstance, which is called Medicare B and a rehab program. That's not what we're talking about in this video. I'm going to share 3 new programs for you that you can begin asking your parents' doctor about, or if you're an older person, you can ask your doctor about in the coming year that could offer a lot of support for you. I'm Pamela D. Wilson. I am a caregiving expert, advocate, and speaker. I've been in this industry for more than 20 years. Please do click below and comment on this video. Follow my YouTube channel because this helps others seeking information about a wide variety of caregiving, aging, healthcare topics, how to deal with healthcare providers, how to deal with all the struggles and the emotional aspects of caregiving. You can find hundreds of videos here on my YouTube channel. You can also make your way over to my website. The link is in the description below. It's PamelaDWilson.com. So let's talk about what Medicare does for family caregivers or older adults who need care, specific to these new programs that are coming out. So know that Medicare, and you probably already do, it's really complicated. And so I'm going to make this information as simple as possible so that it's easy to understand and you can get support. So if you know Medicare and you've been involved in doctors, you know there's a lot of terms that healthcare professionals use that really nobody but them understands because they're so complicated. And they use a lot of abbreviations. And Medicare is very technical. And this is no surprise because it's operated by the government, right? And so the government has a lot of rules and regulations. And honestly, some of this is written in such complicated terms that the average person can't understand it. It's like you almost have to be this rocket science to be able to understand what's in these documents, or somebody who has long-term experience in healthcare. So this document that I'm specifically talking about, and there is a link below, it's called a proposed rule for 2024, and it's called the physician fee schedule. Now, what this does is it offers support in 3 different ways. The document below is 2,033 pages. I've gone through it. I pulled the information out for you. And this is just one document that's issued by CMS, which is the Centers for Medicare and Medicaid. So when you think about this, 2,000-page document, that's a lot to read. This is why healthcare is so complicated, because doctors and healthcare systems have to shift gears and change and make these rules happen. And it's complicated. So the first program that's becoming available is called CTS, Charlie, Tom, Sam. It's called Caregiver Training Services. And what this does is it allows healthcare professionals like a physical therapist or a qualified person train caregivers in daily skills to help the people that they care for. And this is great because a lot of caregivers want to know about, how do I do things? I need more practical skills. So this is beneficial in situations where a loved one needs help with activities of daily living or instrumental activities of daily living. You might wonder what those are because those are healthcare terms, right? So these actually, if you are a caregiver, are probably things that you have been doing for a very long time. But maybe you're not doing it in a way that is super beneficial, or maybe you've hurt yourself doing some of these things, or maybe you're worried about hurting yourself or a parent falling or something. So these are things like what are called transfers. So transfers helping a parent up out of bed, maybe into a wheelchair, or maybe helping them step into the shower or over a high bathtub lid, right, to get into the shower. So there's ways to do that that can reduce the likelihood of a fall and reduce the likelihood of caregivers injuring not only themselves, but the person that you're helping. Then other things are feeding and looking at safety concerns and bathing people. Now, this training is going to be provided in a doctor's office or in a group session. So the challenge is caregivers actually have to find a way to get to this training location and participate. So the process is that you as the caregiver would ask your doctor about this. Hey, do my parents qualify for this? Do I qualify for caregiving training services? And then your parent has to see the doctor, right? Because in healthcare, there always has to be what's called an order or a prescription so that the service can be offered, and then that allows the doctor's office and these people who provide the services to get paid. So it has to be part of what's called a plan of care. That's another healthcare term, or a care plan for the person who needs care. Now, the second part of this, which is even more valuable in my opinion, because I do a lot of personal training on this, it's called Caregiver Behavior Management Training. And this is mostly in a group session, so a lot of family caregivers together. And it talks about behavior management. Now, when you think of this, you might think, well, yeah, my parent, their behavior is bad, right? Well, that's not necessarily what this training is for. It's to train caregivers how to adjust their behaviors so that as a caregiver, you're not causing a reaction in the person that you care for. Now, this is a very specific population of people in need, right? It's people who have mental health issues or a physical diagnosis or a mental diagnosis that relates to like dementia up here, right? Person can't remember things. They can't control their emotions. They can't plan things. They have outbursts. They're angry. And so all of these things that the person who needs care does affect the emotional situation of the caregivers. So this training is really to help caregivers understand better how to respond to these unexpected situations that just happen and the challenging behaviors of the people that you care for, to reduce your burnout and your anxiety and your frustration and everything that you feel because you have committed to this caregiving role that's lasting a long time. So both of these caregiving training programs are helpful because one deals on the physical aspect. So how do I help my parent move around? How do I do these things safer? How do I help them exercise, right? The other is more on the emotional and the behavioral aspect of how do I deal with all this stress if my loved one has all of these problems from a mental health or a cognitive health perspective that affect me. So that's program number one. Now, program number two relates to a medical term called Social Determinants of Health. The abbreviation is SDOH, Sam, Dolly, over Harry. And this program has a couple of aspects. One is an assessment, which I'll explain in a minute. And the other is actually care coordination, which can be very helpful for caregivers. And the concept behind this is that these social determinants of health really have a greater effect on the health of the person who needs care and the caregiver than anyone ever imagined. And why this hasn't gotten more attention before, I have no idea, because it's true. The stress that you experience from being a caregiver, your work life affects being a caregiver, your personal relationships affect a caregiver, your ability to pay your bills and take care of yourself affect your ability to be a caregiver. And if you're the person who needs care, the same thing. You may be on a fixed income. Maybe you can't afford your prescriptions. Maybe you don't drive anymore and you can't get to the doctor's office. You'd love to go for that appointment, but you can't get there, or you're worried about making your copays. So I want to take you through an example of why all of these programs can be complicated. So I recently did a video on why the demands of caregiving are so complicated and why people just really don't imagine it. So to give credit to the healthcare system, right? The Center for Medicare and Medicaid, which again is a government agency funded by the United States budget, right? Healthcare is very expensive. So CMS and all these other agencies constantly try to figure out how to make healthcare better for people, how to improve participation and reduce costs. And they use words like incentives or programs, right? So this CMS program, this proposed physician rule, is really an initiative. And when they put these out, they actually do give a period of like public comment, right? Except the public doesn't know about this, so caregivers and other people don't comment. Mostly healthcare systems and healthcare providers comment before they make all this information final, which is happening right now. So when you look at all of these rules and regulations that CMS, Centers for Medicare and Medicaid, put out, you can think, hey, that makes great sense. But what often is underneath that is, while it makes great sense, what actually has to happen to make this happen? And a very simple example is just a doctor appointment, right? Going to the doctor means that the caregiver or the person who needs the care has to make the appointment. You can do that online. You can pick up the phone and call and do that. So then there's this computer program that makes your appointment. And sometimes, the doctor's office may send you some text messages to remind you that you have an appointment. Or they send you a text message and ask you to fill out some form. Now, all of your medical information are maintained electronically. So in an electronic program at your doctor's office. And maybe you see a couple of doctors, and every time you go, you got to repeat the same old information over and over again, and you're thinking, why do these doctors not have all the same information? Well, it's because not all health systems or doctors' offices have the same computer programs. And computer programs do not always talk to each other, right? They don't always share information. So that's a problem for you as the caregiver, and it's a problem for me as a patient, right? Because I get frustrated that the doctors don't have all my information. So when doctors don't have all the information, it goes back to the caregiver or the person who needs care to be that advocate to say, no, doctor, that's not right. You don't have the right information in my documents. So then behind all of this, in your state, there's something called a health information exchange, which holds more records and more data. And caregivers don't realize this. So here's where it comes up. You'd only know about all these things that I just talked about if when you go to the doctor appointment or to the hospital or some healthcare location, and they hand you this clipboard with all this paperwork, and they want you to sign it. If you read it, you may be able to understand all this stuff that goes on in the background. But the problem is that information is written in very technical terms that most people don't understand. So what you do is you want the appointment, right? So you just sign off on that paperwork and you have no idea what you're signing or what you're agreeing to. But really all of this is so that health information can exchange between these programs, across these programs, so they can bill your health insurance, so the doctor can get paid and all of that. So when you look at these 3 new programs that are coming out from Medicare, realize that A, you should start asking doctors about it, and B, it may take a little bit of time for them to do all of the back work for this to work. But it's a great opportunity for family caregivers to get much needed support, and for the people that you care for to get much needed support. So when anybody wonders why healthcare is so expensive, it's all this back-end stuff that we as consumers or patients don't really see that has to happen in the background that's super complicated. So with regard to social determinants of health, if you're an older person, you may go to the doctor and they may start asking you some personal questions. And you may be thinking, why do they want to know this? This is a little personal. I'm not, comfortable sharing this information. Well, it's because of this new CMS proposed rule that's going to become final. And what it is it's an assessment that you can receive in a doctor's office, or maybe you complete it online or on your cell phone. And it's a survey, and the survey is by this other medical name, right? It's called Prepare, but it's not spelled like you would think. It's prepare, Prapare. And there's other assessments. So these assessments are a group of questions. They're going to ask you things like, do you have trouble paying your rent? Do you have trouble getting to a doctor appointment? Are there issues within your family that prevent you from getting care? Do you find it easy to buy groceries? Can you afford to buy groceries? Have you ever not filled a prescription because you couldn't afford it? So they're asking personal questions which, even though they may seem really personal, it's to your benefit to answer these questions because there's help on the other end. And I'll talk about that in a second. So as I mentioned, social determinants of health are all these things like I don't have transportation to get to the doctor, or I don't have transportation to go buy my groceries or pick up my prescriptions, or I can't afford my prescriptions, or I'm having trouble paying my rent. So all of these things, right, that we have to deal with on a day-to-day basis can prevent us from getting medical care because we have there's too much else to worry about, right? Which is why caregivers don't take care of their health, right? Because you're worried about somebody else and the care that they need so much that you just put your life on the back burner. And so for older adults, while Medicare exists and we think that it should pay for things, it always doesn't pay for the cost of everything, which is quite a shock to people, right? So again, this assessment can identify problems that they can help you solve, okay? And problems that they can help you solve may seem strange because they're medical professionals, but this program has a crossover to what I call community care coordination. So they may refer you to somebody outside of the doctor's office or maybe another person in the doctor's office. And they may say, you know, this person can help you with transportation, or this person can help you get groceries or other stuff. The important thing for you is follow through with those recommendations. Just because the doctor tells people to do stuff, and we know this all the time, does not mean that consumers always follow through. If you're the caregiver, or if you're the older adult, and you come across this program, take advantage of it because there is help out there. May not be perfect because there's a lot of kinks in these new programs getting worked out, but it can help you in so many ways, but you have to take that step to ask for help, to get help, to follow through. So with all of this complicated information, I know it can be easy to get lost in the system and you don't understand what the abbreviations mean and all that kind of stuff. Forget that. If you're offered help, go get it, pursue it. So number 3 is the last program here that we're going to talk about. And I thank you for your patience because I know this is a lot of detail, but it really can help you significantly. This specifically is a program for caregivers caring for loved ones with dementia or Alzheimer's or cognitive impairment. Now it's called GUIDE. That is another acronym. It stands for Guiding and Improved Dementia Experience. Because, as we know, the healthcare system has to have names for everything and abbreviations for everything so that when medical professionals are talking to each other, they can say, hey, do you know about GUIDE? Do you know about SDOH? What about those ADLs, those IDALs? They all know what they're talking about. We as consumers, unless we have experience, do not. So here's the cool thing about the GUIDE program. The GUIDE program, again, has assessments involved, but if your loved one has dementia or memory loss, the idea is that it supports caregivers to help navigate medical care and services outside of the healthcare system, and even find other support. So maybe you're a caregiver and you can't do it anymore, and you have to find an assisted living community. This GUIDE program can help you do that. So again, ask about it, learn about it, because what the healthcare system does is they have really good intentions, right, most of the time. Sometimes they don't realize what happens on the caregiving end and what caregivers go through, which is why it's very important for you to give them feedback and say, you know, doc, that's a great idea. This caregiver training is amazing, but I can't take off work to get there. The government who creates these programs needs that feedback because maybe they need to do something else for caregivers to allow time off work to go get the training. Or some other programs, because we all know that the healthcare system is not perfect. There's a lot of opportunity for improvement, but until the people who are affected by the healthcare system, which would be us, the consumers and the patients, till we start speaking up and participating and giving feedback, nothing's going to change. So all of these programs, CMS believes that people who have access to care, medical care, social care, can advocate for themselves and balance out healthcare problems. So maybe avoid going to the hospital. Maybe your parent lives in their home a little bit longer because they have more support. So the way that they talk about this is they need results and they need medical outcomes and all of that. So when you see all these forms that you have to fill out or they ask you to take an assessment, it's because the healthcare system lives and breathes and dies on data. They have to actually prove that these things, these initiatives that they are putting out there, actually work. And if they can't prove that they work, then the government's like, well, why are we spending all this money if it doesn't work, right? That's why there's all these programs out there and all these duplicative programs in some places. So the best thing that you can do from this video next time you go to the doctor is to ask about caregiver training support services and say, hey, I hear there's a Medicare fee schedule out there that talks about this. This lady in this video explained it to me. If you don't know about it, have your doctor watch this video. Have somebody in your healthcare system watch this video because it's a new thing and it's going to take some time. But you have a right to the services. So caregiver support training, the social determinants of health assessments and care coordination, which can make a huge difference for caregivers and people who need care, especially those who are low income. And then this dementia guide program. So again, make a list. Next time you go to the doctor, start asking about these programs, advocate for yourself because this is the only way that we can move this healthcare system ahead. Thank you for being here. I know this was a long video. I know it's a lot of information, but my goal is to educate patients and consumers and caregivers about the help and support that is out there in very simple terms so that you can understand it and ask for the help that you need. I'm Pamela D. Wilson. I do ask you please click below, follow my YouTube channel, comment below because again, this helps more people who don't know that this help is out there. Find it. We all have to help each other in these caregiving and healthcare situations. Again, if you want more information, go to my website. It's PamelaDWilson.com. Practical information, online course, my podcast, my blog, hundreds of articles in my caregiver library, ways to contact me if you'd like to schedule a personal consultation. Thanks for being here. I will see you all again soon in another video.